All right. So I think Kelsey is sharing the slide with us. So we're gonna go ahead and get started. And has anybody heard of the word epidemiologist before today? Yeah, I see a thumb up. Okay, very good, Sophia. Yes, so we epidemiologists, we work in the field of public health, and we're like an epidemiologist is like a detective for health. If you like a detective, so you can have a police detective for different reasons. We are a detective for health. We help keep people from getting sick by figuring it out, just like a detective. We go out there, we collect data, we ask questions, we engage with people to figure out where sickness comes from and how it spreads. And once we have the knowledge and once we understand where it comes from and how it spreads, then we can do something, right, to remove the cause of sickness outside of our communities to keep our communities safe. So, for example, let's say if you were going to school, right? And if you were all in person together, and let's say that a lot of people at school, right, get a stomach ache, then the school will call one of your health offices and likely talk to an epidemiologist. And we would come and try to figure out why. Why is it that everybody's getting a stomach ache around the same time? Maybe it was from something that you ate. Maybe there was a germ going on around. Our job is going to be to solve the mystery, right? And help people stay healthy. So that's who an epidemiologist is. And next slide. Now, there's different ways that we can get sick, right? Can anybody share with me? And you can take it from my slide as well. What are some of the different ways? Yes, go ahead, Sophia, that we can get sick.
Like touching things, and you could get maybe you could touch bacteria like disease.
Very good. Yes. So maybe we touch things, right? When we're out there, we're playing or, just opening doors because we went to the grocery store, we're touching things. And when we touch things, sometimes what happens is, yes, we touch bacteria and then it stays with us. It stays on our hands, for example. And then we eat with our hands, or maybe we touch our eyes or our ears or nose, right? And that can get us sick. Very good. What about you, Valerie?
Maybe if we're hanging out with other people who are sick, they
Yes.
could pass it on to us.
That's right. Very good. So there are some type of diseases that are contagious, what we call contagious, meaning that if you are around someone who has that disease, they can pass it on to you. That's what we call, as epidemiologists, we have a very fancy word for it. We call it an infectious disease. That's an infectious disease, hanging out with someone and then they can pass it on to you. And sometimes when that happens is when the cause of the disease is is a virus, for example, right? Like the flu or COVID, because it's the virus, the flu virus or the COVID virus that's making the person sick. When we hang out with them, the virus can jump from that person to our bodies. And the viruses are like really tiny, right? And they can also they can live only inside of our bodies. So they're always looking for someone like a host, right? We call it a host, some place where they can live, and it's only inside of your body. And when we catch it, though, even though the virus is happy because it has a home to live and grow and make more viruses, it's not really a good situation for us because it makes us sick. Okay. Which is not the case sometimes with bacteria. There is the bad bacteria that can make us sick, right? The ones that maybe we touch by opening doors or, not washing our hands after we finish playing. But there are also good bacteria. For example, did you know that you have a lot of different types of bacteria in your stomach that actually help digest your food? Yeah? Yes. So we have a lot of bacteria that helps us digest our food and healthy. We want these healthy bacteria because we cannot digest our food alone. This is why sometimes we eat probiotic, right? Or we take probiotic. Okay. But sometimes we get sick not from a virus or a bacteria. Sometimes we just get sick because there is a lot of stress on the body. Did you know that having a lot of stress sometimes can affect our health? Yes, right? So, and the type of disease that we get sometimes from stress is not an infectious disease necessarily. It's non-contagious. It's called a non-communicable disease or a chronic disease. Does anyone have does have if you do you have an example? Do you know can you give me an example of what a non-infectious disease could be? A disease that someone has, but you can hang out with them and they're not going to pass it on to you. Yes. Is it Zelda or Ariana?
Cancer.
Yes, cancer. Someone can have cancer, you can hang out with them, you can give them a hug and take care of them, and you're not going to get sick from their cancer, okay? So that's a non-infectious disease. What else? One more person.
Maybe think
Another
about
disease.
things. Yeah, sorry, Dr. Fatimata. Maybe think
You
about
got
things that your family members might have, right? And they say, "Oh, I have this," but you still hang out with them, and you're not worried that you're gonna catch it. You guys think of any examples?
Yeah. There's some dishes like they can't eat a lot of sugar too.
Oh,
Ooh, what's a disease that you cannot have sugar? Yes, Sophia.
Diabetes.
Diabetes. Exactly. Were you going to say diabetes to Valerie? Yes. And there's type 1 diabetes and type 2 diabetes. But yes, when you have diabetes, you cannot eat sugar, right? And it's an example of a non-infectious disease. Okay, so then if we get sick from viruses or bacteria or stress, what do you think we can do to prevent being sick? So if you are an epidemiologist and you figure that out as a detective, oh, the virus makes people sick, bacteria makes people sick, stress makes people sick. So now what would you say? What would you implement so that people don't get sick? Do you have your hands up, Sophia? And then Valerie, you're next, okay?
Eating healthy and probably washing your hands.
Absolutely. Very good. Yes, eat healthy food so that your bacteria is happy in your tummy and you have good food that nourishes your body. And then wash your hands, right? To get rid of the bacteria that you come into contact with. What else? Valerie.
Hold on.
I was also going to say washing your hands.
Yes, it's very important to wash our hands, right? Washing our hands maybe before we eat, but also sometimes washing our hands after we play. You can play outside and play with friends, washing hands after we use the restroom, right? So yes, so this is one of the ways that you get rid of the bacteria. How can we how can we prevent getting sick from a virus like COVID or the flu?
We could wear a mask all the time so we don't get sick.
That's right. Very good. So a mask can filter out the virus, right? So that it's not jumping from someone to you. For example, I still wear a mask when I travel on the plane because I'm sitting very close to people, right? And that's one way to stay protected. Yes, Sophia.
By getting the flu shot or vaccine.
Yes, by getting the flu shot or the vaccine. This is a really fun fact, but hold on, I'll show you this. I went to the hospital today and look at this. I got my flu shot and my COVID vaccine shot. Oh, and they give me a sticker. And I was so happy. I'm always afraid when I go, and the doctors and the nurses try to I'm always afraid of needles, but I still go because I know it's really good for me and good for all the people around me. And as an epidemiologist, I love keeping people also that are around me healthy. So yes, so you can get a vaccine. Vaccines are like superhero shields for your body against those viruses. And if stress makes us happy, then how do you think, what are some of the ways that we can, how can you reduce stress or, you know, lower stress so it doesn't make you sick? What do you think? Yes, Valerie.
Meditating.
Meditation. Yes. Yes. Okay. Who else? Sophia. And then Jocelyn, you're next.
Like do the stuff you like so you can enjoy it.
Yes, absolutely. Absolutely. The things that makes us happy, right? Go ahead, Jocelyn.
Maybe like a help pet, like a pet that you could, like maybe a dog.
Oh, yes, because they make us happy too, right? It makes us feel relaxed. Yes, absolutely. Like a pet. Adam, you're next.
You could read like your favorite book or play a favorite game that you like.
Yes, absolutely. Oh my goodness. I think that you all will be excellent epidemiologists. Look at that. You have all the answers. You have all the answers. And it is true. It is true that you can meditate, you can draw, you can do, like there's a number of things like playing or laughter. Have you ever watched a really, really funny video, like a funny YouTube video or a very funny movie, and you're laughing? It feels good, right? And drawing, playing with your friends. As an epidemiologist, I did a research where we looked and see if yoga and meditation and qigong actually help people who live with diabetes. And I did an investigation and I looked at a lot of data for 30 years of data. And it turns out that when someone has diabetes and they practice meditation or yoga or qigong, it actually helps their blood sugar level go down. So it helps them stay healthier. And it's really good. Like it can help just for some people, sometimes it helps just as well as, taking a medication. Isn't that interesting? I didn't think that was going to be the case until I did the research myself. Very cool. Okay, so since you are all doing a really great job, right, as uh be thinking like an epidemiologist, I want to ask you another question. Okay. But before I ask, I want to say again what Andrea said before and Kelsey. See, when you become an epidemiologist, right? So if you think about a doctor, when you go see the doctor, usually it's just you, right? It's just you and whoever took you to the doctor and your doctor, right? And so when you see a doctor, you will notice that for the doctor, the patient is an individual. It's one person at the time. It's one person at the time. But when you're an epidemiologist, your patient is the entire community. Every time when you're doing your work, your research, you're thinking about your patient as the entire community. We call it our population, right? It's the entire community. So you think about your entire city as one person. Maybe how one part of the city, if there's water, good water here, how that impacts everybody. Or if people are getting sick in this neighborhood, maybe it can affect other people. And then sometimes you can think of the entire world as like one giant, right, being. Like it's like, and you always think from a big picture, and you always want to make as many people as possible healthy. Okay, so I want you to think now as an epidemiologist, and I want to ask you this question: if an epidemiologist, patient is the entire community, and they want to make many people healthy, where do you think epidemiologists work? Where can you find an epidemiologist? Where do they work? Yes, Sophia.
Like at a health center, like hospital.
Very good. Absolutely. Like a hospital at the health center. Right now, I work at the University of Southern California at USC. but I'm actually at the hospital, at the School of Medicine. Yes, fight on, Kelsey. Where else? Anna?
Like a lab to find out different bacteria or viruses that are causing the sickness.
Absolutely. So some of us are at the hospital, some of us are actually in the lab or working in like a really big biotech companies, right? I think about the ones who came up with the COVID vaccine a couple years ago. They were in the lab. Very good. Okay, who else? Is it Ariana or Zelda?
Ariana.
Hi,
And
Ariana.
I they could work in CV, yes. That helps.
Where else do they work? The epidemiologists?
Yes. The help center, like where they draw blood and stuff.
Absolutely. Like the health centers in the community. Yes, yes, absolutely. You know, sometimes next time when you go to your health center or a lab, ask them if they have an epidemiologist or if there's an epidemiologist that they work with, because oftentimes we are like the person behind the scene. So, when people go to the hospital, they just see the doctor, right? And the doctor gives them a prescription that's going to help them. But there's someone behind the scene that's doing all the investigation and then also making developing the medication. And that's the epidemiologist. Very good. All right. So yes, you can have epidemiologists at hospitals, universities, and labs, community health, and even in government agencies. Sometimes the government leaders, the political leaders, they need epidemiologists there, like the FDA, the Food and Drug Administration, right? Talk about regulations for healthy food, or the USDA. Okay. And this is very important. I'm going to give you an example, right? Where I was just sharing this, and Kelsey and Andrea have heard me share this, but this week alone, there was a group of epidemiologists who did an investigation in France. And have you heard of the country France? Yeah? Yeah, yeah. Alrighty. So, has anybody ever had tuna here? You heard of
Yes.
tuna, eaten tuna? Yeah, it's me too. So, you know, there's a lot of regulations that happen. For example, with tuna, because it's out there in the ocean and it can be exposed to mercury, which is not good for our health. It's very important that the tuna we buy at the grocery store doesn't have mercury, or it has a very, very, very low levels of mercury that cannot affect our health because we're going to eat it, right? And it's going to go in our bodies. And so there was a study that was done by a team of epidemiologists and scientists in France just this week, and they tested 150 different types of tunas, canned tunas, to see whether or not they met those regulations. And what they found out, which is not a good news, but it's good that they found out, was that actually the tuna that was at the grocery store had very high levels of mercury. Too much high that's good for our health. And so they talked about it and they told the government officials, the government agencies. So now they can, come up with policies to make sure that that doesn't happen so people can stay healthy. Okay, so you all guessed really well. I'm so impressed where epidemiologists work. Now, one of the ways that our job works and how we can do a good job because we take care of the entire community is that for us, it's very important to work with other people. We need to be in teams. We need to collaborate with other people in the healthcare, in public health. So, in your opinion, right? Like, who do you think epidemiologists work with? Sophia?
With other epidemiologists and people.
Absolutely. You got it. We work with other epidemiologists, right? We collaborate with epidemiologists who are in a different state, sometimes a different country, because I also need to know what's happening on their side, right? So we can have a better idea. And we work with people in the community, because if I need to make an investigation, if I went to your school because there were too many people having stomach aches, you betcha I have to talk to you to interview everybody. Yes. Ariana, go ahead. Oh, and then Anam, you're next.
I think they work with scientists.
Yes, you're right. We work with scientists. We work with all kind of scientists. Some of them are called biostatisticians. We gather a lot of data and then we need to make sense of the data. And so usually we work with statisticians or biostatisticians. I think you might have talked about biostatistics before in your class, right? Okay, so who else? Anam, who do you think epidemiologists work with?
Epidemiologists work with like parts of the body that are getting sick for humans.
Absolutely. Listen, I'm going to give you an example, okay? Right now, I am investigating and doing research on cancer. Now, there's different parts of the body that can get cancer, right? And I am specifically focused on some parts of the body. I'm focused on the breast for breast cancer, and I'm also focused on prostate cancer. So those are very specific parts of the body that I'm investigating to understand why do people get cancer there. So you are right. Very good. Very good. All right. Anybody else? So Kelsey's right. So she was showing the next slide, and as you can see, you guessed again everything right. We work with doctors and nurses, as I mentioned, right? Usually when you see a doctor, we are behind the scene doing the work with them. We work with public health officials. This is how we make regulations. This is where, we decide what's okay for what type of food can be at the grocery store, what type of food cannot be at the grocery store, to say what is the recommended levels of physical activity for people. And we also worked with officials to make sure that there's no smoking in public. Can you believe it that there used to be a time, right, when people actually smoked everywhere and it was okay? They smoked everywhere. They smoked at the restaurant, they smoked at Disneyland, they smoked in the classroom. The teacher could smoke in the classroom. They smoked on the airplane. They smoked everywhere, everywhere. And then the epidemiologist did an investigation and found that smoking is bad for your health. So then we showed it to the health officials, and they made a new law that says you cannot smoke in public anymore. How cool is that? Yeah,
I think that's cool.
that's really cool. So yeah, we work also with scientists and community leaders. Very important to learn or to work with the people that are also more connected to the community, so they can also help us get in touch with the community and we can serve them better. Okay, so now I want to hear from you. I've been asking you a lot of questions. Do you have any questions for me? Yes, Ariana?
How much hours do you work a day?
That's a really, really, really great question. About 8 hours a day. And I usually work Monday through Friday, and I'm off on weekends. Sophia?
What was the most deadliest disease you ever discovered?
Wow, that is an incredible question. Now, I haven't discovered a specific disease myself, but I have worked on a number of different diseases that affect millions and millions of people, Sophia. So the diseases that affect the most people that I have worked on include diabetes, right? There's like almost 500 million people around the world who have diabetes. That's a lot, right? And so I worked on diabetes. I worked on cancer, as I mentioned, right? Breast cancer, prostate cancer. And then I've also done some investigations on other small outbreak and, outbreaks where schools, kids get a lot of stomach ache at the school. And, we need to investigate to find out what is the source of it. So I worked on that as well. Yes, Anam, you're next.
Why do epidemiologists work with sickness and disease and bacteria and all the stuff? Yeah.
Yes, that's a really great question. So the reason why we work with all that, we work with sickness and bacteria and viruses, is really because of what we care about. We just care about people being very healthy. Because when people are healthy, they feel good and they can do so many things that they enjoy. They get to play, they get to spend time with their family, they get to do art, they get to invent things, they get to paint, they get to make the world a better place. But have you ever experienced being sick? It's not fun, yeah? And then you just have to stay home and you can't do the things that you can usually do. And so, really, what we do as epidemiologists is we always want people to stay healthy. And when people were not healthy, we just start there and we investigate and we ask, why is this person sick today? And this is how we ended up discovering that it's viruses and bacteria and stress, for example, that make people sick. So then we have to study them and investigate them to understand how they work, what happens, and how do they make people sick so that we can stop them from making people sick. But we work also with, that's just one part of what we do. The main part and the most important is to keep people healthy and keep people healthy as long as we can. That's why we also work on studying food, for example. And so we study and investigate the food that makes you healthy. And we can tell you, for example, like your fruits and vegetables are very healthy for you, but other type of foods may not be so healthy. So you can eat it, but not too much, for example, right? Or exercising is very healthy. So we're also interested in all the good things for us that keep us healthy, not just the bad things that make us sick. Any other questions?
You have time for maybe one more question. This might be
One
the
more
last time you get to
question.
ask one. Yeah, do it.
Yes, Sophia.
What is your most favorite disease?
Wow, that is a really, really, really big question. I'll tell you what, I don't necessarily have a favorite disease because I don't like disease myself and I don't like when people I care about are healthy. But yes, go ahead, Sophia.
Like what I mean is like to study.
Yes, but I do have a favorite disease to study. And one of them for me will be diabetes. I think it's a very interesting disease to study. Okay, that's one of my first favorite because it affects so many people. So if there's a way to figure out a way, like I know people in my family who have diabetes, right? And I can see that it's a pain. They cannot just eat anything they want. So if I could do anything to help those people get better or to discover some kind of, treatment or practices or medication that can make their life better, that would be great. But also because I know it's a disease that's growing very fast everywhere around the world. So, for example, right now, uh, I didn't tell you this, but I was born and raised in a country in Africa. My country is called Burkina Faso. There are already millions of people who have diabetes in Africa, but this number is said that it's going to even double in 6 years if we don't do anything. That's going to be a lot more people, right? So I'm very passionate about finding ways to slow that down so less people, end up being sick and having to manage diabetes for many years. Ariana, I see your hand. Kelsey, can we take one more question? Adam has a question too.
How do we prevent diabetes?
That is an excellent question. So, there are a number of ways that we can go about our life to prevent diabetes. For example, you are all very young. So, that's one thing that's in your favor. When we're young, our bodies are so resilient and they do really well. So, if we develop good habits, we can prevent diabetes. For example, do some exercising, right? A lot of physical activity is good. Okay, eating healthy. So we want to eat more fruits and vegetables and maybe less sugar. I know today's Halloween, so enjoy your day, but we want to avoid eating a lot of just greasy food and fast foods, for example, right? All the time. Drinks that have a lot of sugar. Drinks that have a lot of sugar are not healthy for us. So if we stay away from it and we just build those healthy habits over time, it's going to lower our chances of getting diabetes. Adam, you're next.
Why did you want to study viruses and bacteria?
So what I really wanted to study as an epidemiologist is just people. I love being an investigator that, like just is out there and it cares about people's health because I always wanted to be a public health professional. I wanted to be in healthcare and I didn't want to be a doctor. So there are doctors and nurses, but you can be other things and help people's health. And so because I chose to be an epidemiologist and I needed to, investigate in people's health, I found out that one of the ways that people do get sick often is through viruses and bacteria. And because of that, it's important to study the viruses and the bacteria to better understand how they make people sick. Does that make sense?
Yeah.
Yeah, I see a thumb up. Very good. Okay. This has been so great. I've enjoyed speaking with you so much. You are all so just engaged and knowledgeable. If any one of you ever choose to become an epidemiologist, you will be a great epidemiologist. I can tell you that for sure. And if you ever have any questions, okay, I work with Miss Kelsey. She's one of my collaborators and workers. So as an epidemiologist, I work with her. So you can always give her your questions for me, okay? If you have more questions for me. Does that sound good?
All right, everybody, give a big thank you to Dr. coming today. Fatima.
Thank you. Bye-bye.
Thank you.
Okay, WonderKids, we're out of time for today, so we won't do our drawing activity, but it's okay because I see you guys learned a lot. I'm really proud of you guys for your engagement today and always. So happy Halloween, enjoy your candy, okay? And dressing up, and we'll see you on Tuesday next week, okay?
Okay, bye. See you.
Okay, bye guys.
Bye.
Bye.
Thank you.
Happy Halloween.
Bye.
All right, bye guys. Awesome. Okay.
Bye-bye. Sorry, I didn't mean to take all your time, but I didn't want to cut them off either. They were asking
No.
so many questions.
No, we love it when the speaker talks the whole time. So it's great. I mean, it's just like sometimes we worry we didn't plan enough. So that was awesome. Yeah, they were
Okay,
loving
great.
it. They were loving it. So thank you.
They're
Yeah,
so
they loved
smart.
it. They
Oh my
came to see
God.
you. So
They're
that's
so
fun.
smart. Like every week they surprise us. Like we're trying to break things down and then we're like, okay, let's just throw extra terminology in there because they're just obviously getting it, Like
Yeah.
they're impressive, honestly. Really.
Awesome.
Yeah.
Well, you
Well, thank
ladies are
you
doing a
for
great
coming.
job.
Yeah.
Yeah.
Well, Fatima's out there, so I'm gonna go chat with her in person. Andrea, are you good for the deadline on
Yeah.
Tuesday? You're okay for that? Awesome. So yeah, focus on that and don't worry too much about the videos for now if you don't have time.
Okay. Okay. Thank you.
Okay.
Tell,
So if you have any questions about the slides, I'll do my best to respond on Slack, but I don't always pick up the Slack messages over the weekend like quickly. So if you do have any questions about the slides as you're making them, just let me know.
Of course, of course. Yeah. Thank you so much. Tell Dr. Fatimata that my biggest thanks. It was a great.
Oh, of course. You're super welcome. Andrea, have a happy Halloween. I hope you get to eat some candy.